I'm Sarah Smith. I'm your vice chair for the local alcohol and drug planning committee. This is our regular meeting, March 23rd, 2022. So we can go on to the strategic planning initiative. Is that you, Denise?
Yes, thank you, Sarah. So I'm going to share my screen and share a view of the timeline for the strategic planning initiative. So as of March 11th, we completed the needs assessment. We did about 17 focus groups totaling over 35 people, and we had 79 survey responses. Comagin is currently holding all of the qualitative and quantitative data and are conducting analysis, and we'll be presenting needs assessment findings at the SPI leadership meeting Monday, April 11th from noon to 1. We also have reached out to Eric, Sarah, and Rochelle to get on the agenda for the LADPC April meeting to give that same needs assessment findings presentation to this group. As of April 18th, we'll have the written report from Comagin to share out with everyone here, everyone who's participated in the interviews, and all that have been part of the SPI leadership team. In the meantime, right here, Synergy is developing strategic planning tools in order to guide work groups in devising actions, goals, and objectives around the gaps identified. We'll also be considering other bodies of work that are happening within Jackson and how the needs identified intersect and coordinate in those spaces. We're also working with JCC and their partners to take part in the Jackson County SuD Summit that is scheduled for May 17th. And at that session, we'll have the strategic planning tools built out in Mural so that at the end of that summit, we'll be able to have an active work group. Also, again, in May, we would be hoping to join the LADPC with that mural and get feedback from this group as well, as far as where points of intersection and coordination aligned with the gaps and needs and solutions that have come through these needs assessment processes. And then as of June 1st, we'll have a draft strategic plan written to share out with the group for feedback, and a final plan delivered to all Jackson leadership here as of the end of June. So that's where we stand right now.
Denise, there may be people on this call who are not quite sure what SPI is. Could you describe briefly what you've been up to?
Sure. My name's Denise Acker. I'm with Synergy Health Consulting, and we are contracted by Lines for Life through OHA to help project manage the Strategic Planning Initiative, which is an SuD care coordination assessment and planning project that is held by Jackson leadership and Jackson led. We just act as the facilitators and kind of the workforce capacity to do the needs assessment analysis, drafting of the plan, and facilitation of work groups. So what the project is aiming to do is look across the SuD care coordination spectrum and identify gaps and needs, and also gather feedback as far as solutions that have been identified for coordinating services. And as I've said, we've completed the needs assessment. So now we're in the process of analyzing all that data and outlining it so that we could do some work groups together. And this work, again, is working around work that's already happening and underway with the Crisis Response Network and the Burn.
Thanks, Denise.
No problem.
Any questions for her? I think this is it. Till next month. Enjoy the spring.